Hi, my name's Sam Finnekin. I'm a GP in Sutton Coldfield and I have an interest in personalised care and cardiovascular risk. In this video I'm going to talk about how personalised care can help our patients reduce their cardiovascular risk. Helping people reduce their cardiovascular risk is one of the most impactful things we do as health professionals in terms of reducing premature morbidity and mortality. However, it can be difficult sometimes to engage and motivate our patients because through the very nature of preventative medicine we never actually see the benefits. By taking a personalised care approach, I think that we can really help engage our patients in making sure that reducing cardiovascular risk is something that they get involved with, and we can work together to fulfil this important part of our role. So what does personalised care mean? Well, the NHS is committed to personalised care being the standard of practice. We use the comprehensive model for personalised care, which consists of 6 main components. When it comes to cardiovascular disease prevention, I think we can focus on 3 main ones that help us. Firstly, there's shared decision making. Secondly, there's supportive self-management. And finally, there's the work we can achieve through social prescribing and community support. Shared decision making is an approach to decision making that recognises the importance of both the clinician and the patient's contribution to the process. The clinician, your responsibility is to make sure that you present all the options that are available to the patient and give them evidence-based information about the potential risks and benefits of all the options. The patient's contribution comes in telling you about how they feel about the options, how they fit in with their life and their individual values and preferences. Sometimes it's important that you help them contribute this information and help them bring it to the table. Then the decision that can be made is integrating all the evidence base and the patient's values and preferences to make sure that that decision is personalised to them. It may be that the decision that's made isn't the decision that you would recommend for that person, or indeed the decision that would be most recommended by the clinical guidance, but it will be the decision that's right for them if you've followed a shared decision-making approach. Although in principle shared decision-making is quite a simple proposition, in reality it's actually quite a complex and advanced consulting skill that requires practice, training and a degree of self-reflection on how we currently practice. It's worth noting that both the GMC and NICE have made it quite clear that shared decision-making isn't optional, but indeed should be the default way we now practice medicine. We all know that patients sometimes find it difficult to follow the plans that we come up with in our consulting room. Shared decision-making makes sure that patients are involved in the decision-making process and hopefully that they're engaged and bought into the plan that's made. By doing things this way, the patient is more likely to follow the plan when they leave the consulting room and hopefully improves adherence to medication and lifestyle changes that we know will help improve their cardiovascular risk. So what about supportive self-management? We all know that healthcare only adds a little bit in terms of reducing cardiovascular risk. Much of the gains that can be made exist outside our consulting room and prescription pads. The changes that people can make to their lifestyle in terms of smoking or activity or diet have a huge impact on their cardiovascular risk. Our role as clinicians is to help support patients making positive lifestyle changes that will help them reduce their risk. Some of this can be done within our consultations, and we can help patients by talking to them about what changes can be made. We can direct them to resources, whether it be leaflets or videos or online resources such as those on the Birmingham and Solihull Healthy Hearts website. But it's also important to remember that we have our wider community team to help us help people reduce their cardiovascular risk. So working with our practice nurses, our HCAs, but also our social prescribing link workers or our health coaches who can take a really personalised approach to helping people reduce their cardiovascular risk. Everybody has different needs and motivations and capability to change when it comes to lifestyle. Taking a personalised approach recognises this and makes sure that the advice we give them is suitable for that person and helps them really make those positive changes that will reduce their cardiovascular risk. So by taking a personalised approach to healthcare, we make sure that we're using all our skills as clinicians and utilising all the skills of our wider practice team. We can make sure that our patients get every chance to make the decisions that help them reduce their cardiovascular risk and live their lives in good health for as long as possible.